Good morning. I'm Monique Williams and I'm from Section 6 and I am going to demonstrate how to do a nasogastric tube insertion and irrigation. I've already done all of my hand hygiene outside this patient's room and I've gotten all of my equipment together and I've checked the MD orders to make sure that this patient can tolerate an NG tube insertion. So now I'm going to go in and I'm going to introduce myself to the patient. Knock, knock, knock. Good morning. I'm Monique and I'm a nursing student. How are you today? Good. I have been given doctor's orders to do a nasogastric tube insertion and irrigation. Have you ever had one of those done? No? Okay. Well, first, can you tell me your name and your date of birth? Okay. Kelly Jackson, 3/23/23. Well, it's very nice to meet you, Kelly Jackson. So you say you've never had a nasogastric tube. Well, the first thing that I have to do is I have to sit you up, and I'm actually going to walk you through all the steps that I'm going to do today to insert your nasogastric tube. So I'm going to put the patient in a high Fowler's position. Make them comfortable. So are you comfortable? Okay, very good. So the first thing I want to do is I want to look inside your nares. Check for patency. Everything looks good. I don't see any deviated septum in there. Very good. I want to check your throat and your mouth to see if there's any sores. I don't see any. Very good. I'm going to occlude one of your nares. Can you breathe out? Very good. And I'm going to check the other one. Breathe out. Very good. I'll use the right side, right nair, for patency purposes. And then can I also have you cough? Okay, very good. So the next thing I'm going to do is I'm going to don my gloves. And then I am going to measure the NG tube. I'm going to measure from the tip of the nose to the top of the ear down to the xiphoid process. So that's about how much I need. So I'm going to take that off. Okay. And then I'm going to lubricate my NG tube to make it sterile and easy for insertion. So I'm going to sit this here and get the patient ready. Put a towel here. So the first thing I want you to do, Ms. Jackson, is I'd like for you to tilt your head back, and I'm going to insert the nasogastric tube. Then I'm going to take my pen light to make sure that it's not coiling in the back of the throat. Looks good. So now I'm going to have you lean your head forward with your chin to your chest. And as I am progressing the NG tube, I would normally have somebody helping me and have this patient to sip and swallow as I am progressing the NG tube as far as it will go. So this is about as far as it'll go. I'm going to take this in place so that it'll stay. Can you speak to me, Kelly Jackson? Okay, very good, very good. So it's clear. Okay, and the next thing I'm going to do is I'm going to aspirate some of the stomach contents to make sure that it's in the right place. Take out some of the stomach contents. And then I'm going to put the stomach contents on some pH paper. It looks like the stomach contents are consistent with normal gastric secretions. They're between yellow to a greenish color. and it looks like the pH is about a 3. So that's consistent with gastric acidity. So then I'm going to put the rest of the stomach contents back into the nasogastric tube, and at the same time, I'm going to listen to this patient's abdomen for bowel sounds, and I hear normal swishing. How are you feeling, Kelly? You doing good? Very good. Okay, so it looks that the nasogastric tube is in the right place. So I would then hook the nasogastric tube to suction. And because we have some extra tubing, I would take a rubber band with a safety pin attached. And I would attach it to the patient's gown so that they can turn their head and move as they need to. I would also tape this in place by taping it over the bridge of the nose and using any extra tape and wrapping it around the nasogastric tube. And then if the facility protocol is that I would measure, or you want to verify placement, I could take this patient to have them have a chest x-ray so that you could verify the proper placement of the nasogastric tube. And then I would document how many attempts that I did, and I got this on the first attempt, document in the patient's chart the color of the stomach contents, also the pH, which nair I use, and I would also measure the length of the exposed tube beginning at the nair. So that is how I would do the basic NG insertion. Now I would like to irrigate this patient's NG tube. So I would do that by unhooking it from the suction, and then I would draw up 30 milliliters of the patient's contents, stomach contents. And then I would reinsert it back in to make sure that it's consistent. I hear normal swishing sounds, good bowel sounds, and then I would draw up 30 milliliters of normal saline or water. And I would insert this into the NG tube. And then I would draw the 30 milliliters back out. Hook the NG tube back up to suction and discard the 30 milliliters of solution. So that is it. It looks like you have good placement for your NG tube. Your stomach contents are consistent with normal gastric secretions. You tolerated this very well. I'm going to complete my completion protocol. I've already hooked her back up to suction. I'm going to lower the bed and lower the head of the bed. I'm going to put the call button in place for the patient to call me. If you have any challenges or issues, please feel free to call me, but I'll come back and check on you in a little bit. And I would just document all of this in the patient's chart, and that is it. Thank you. Have a good